it hasn't proven to be the silver bullet that I think many of us hoped that it would, show to be in the literature over the past few years. I mean, it's obviously a condition that takes years, if not decades, to develop in the brain. And I know some of the studies, and they're small studies, but they've shown, that there's some therapeutic benefit depending on how early it's adopted, right? Like for milder Alzheimer's as compared to more severe Alzheimer's. Why do you think that is the case? You think by the time it progresses to more moderate and severe levels, it's just like too much pathology at that point?
I'm so glad you asked this question, because you're absolutely right. And so one of my jobs, one of the things I do is I teach a CME clinician training program for ketogenic diets and mental health. And the first module of that training program is all about what the clinical studies tell us about ketogenic diets in various types of conditions, not just bipolar disorder and depression, but also dementia, right? And what you say is absolutely true. The clinical trial evidence on ketogenic diets for dementia is pretty unimpressive. So, and I make that point in the training program that, look, these are pretty minuscule improvements. The results, yes, they're as good or maybe a little better than existing medication treatments, but that's not saying much, because existing medication treatments have a dismal track record of improving cognitive function in people with mild cognitive impairment and early Alzheimer's and moderate Alzheimer's disease, right? So why do these studies, if the ketogenic diet is so amazing at, bridging that energy gap, shouldn't the brain come to life, and shouldn't we see better results? Two ideas I have about that. One is that in these studies, the highest, they were even the best designed randomized controlled trial I'm aware of to date, got the ketone levels, the beta hydroxybutyrate levels in the blood to an average of 0.95 millimole, just below 1 millimole. That's, maybe they didn't get as much response because the diet wasn't ketogenic enough, the ketone levels weren't high enough. That's one possibility, but I don't know, because we haven't done the study with higher ketone levels. But the other thing is, as you say, this is a neurodegenerative disease, meaning brain is dying, brain tissue is being lost, and it starts decades before, in many cases, as you said, rightly said. This is a disease that is developing over decades silently in the background. Brain glucose metabolism is becoming more and more sluggish over time. And that's one of the hallmarks. That's one of the drivers of the disease is sluggish brain glucose processing. So could it be that there's a point of no return or a point of minimal, diminishing returns? That could be a big part of it. That, maybe you've lost too much tissue or too much function, or it's too late, to do anything about it. Obviously, prevention is much more important in these cases than treatment. And you cannot begin too early to prevent dementia. I don't care how old you are. If you're 7 years old out there, you want to start now, right? To protect your brain metabolism by eating whole foods and keeping your insulin and glucose levels in a healthy range. That's what needs to happen. One of the many things that needs to happen. So why don't we see? So we don't see great results in these studies. Could it be that the ketone levels are low? Maybe. Could it be that, we've reached a point of diminishing returns? Maybe. Could it be that the diet wasn't good enough? Not just ketone-wise, but they never tell you what people are eating in these studies. It's so funny. You look right at the method section, they won't tell you. So what I can say is that you can sometimes see really excellent results in certain cases of even what you might think would be dementia that would be difficult or impossible to reverse. So I've seen this in my own practice, and I include a case in the book of a woman who had mild cognitive impairment for something like 20 years, starting in her early 40s after a head injury, who was thought to be progressing to dementia in her early 60s, was given that tentative diagnosis, was referred to a neurologist, said, "Oh, you can see a neurologist to confirm the diagnosis in 10 weeks. Meanwhile, enjoy your life," right? So she started a ketogenic diet while she was waiting for her neurology appointment, got her ketone levels. I said, please, I recommend getting your ketone levels up above 1 millimole. Try to keep them in the sort of 1 to 3 millimole range as often as you can. She followed the diet to a T, and within weeks, her cognition improved noticeably. Her chief complaint originally, when the thing that really got her attention and why she went back to her doctor to get that diagnosis was this: she sat down at her sewing machine that she'd used almost every day for 50 years, couldn't remember how to thread the machine. She was terrified. So she was easily able, after the ketogenic diet, within just weeks, thread the machine, sit down, have long, fluent conversations with her son, which had become a problem, able to find her car in parking lots, which had been an issue for her for years. By the time she got to the neurologist, her memory testing was normal.
Wow.
And so he said, this is the wonderful thing we're starting to see. He said, I'm so glad you're on this diet. This is a really good diet, for this condition. And he was thrilled that she was on the diet and told her to keep it up. And so she continues on this diet to this day. She's been on, I think, a couple of years to almost 3 years now, still doing very well. And so you can see this in patients if you work closely with them. The other thing is that there was a beautiful case report published. I don't know if you've seen it, just in recent months, of a woman with Down syndrome who had progressive dementia. Have you seen that case report?
No.
I want to bring it to your attention because I think you would find it so useful in your work. So this was a woman in her 40s with Down syndrome, and Down syndrome is, a genetic condition for people who are listening who might not know. People are born with Down syndrome. It's a very severe brain condition, genetic, and due to in any case, a genetic condition. I won't go into the details. These are people who are profound intellectual disabilities, and they're very high risk for severe, rapidly progressive, early onset dementia.
I didn't know that.
Yeah, and so for people who work with people with Down syndrome, that's very well known that they almost always develop, usually in their 30s or 40s, and that's usually how they die. Their lives are shortened by decades, usually by the dementia. And so this woman, just as the textbooks would say, she was actually fairly high functioning for somebody with Down syndrome. She lived with her mother, and her mother provided quite a bit of support. But this particular woman had a lot of richness in her life, and participated in social activities, and was fairly independent with a lot of her self-care. And then in her 40s, she started rapidly declining. And her activities of daily living, within 4 years, she developed seizures, psychosis, and complete dependence on her mother for activities of daily living and self-care. And the mother had heard about ketogenic diets, but never in a million years thought that her daughter would follow a ketogenic diet, thought it would be too challenging. And so she put her on a paleo diet. The daughter, who obesity is also very, very common in people with Down syndrome. This woman was also had obesity, lost a lot of weight on the paleo diet, but no improvement in cognition. So the mother lowered the carbohydrate intake a little bit more, got down to 75 grams a day. The daughter lost a little bit more weight, still no improvement in cognition. So then, with the help of Dr. Annette Bosworth, a physician in Florida, they happen to live in Florida, went on to a ketogenic diet, and the seizures disappeared, the psychosis disappeared, her activity of daily living score came back to its previous baseline. She was able to re-engage in all of the social activities, all of the activities of daily living that she had become dependent on her mother for. And there's actually a video interview of her with her mother, done by Dr. Brett Scher on the Metabolic Mind website, where you can hear the mother's story. It's just a remarkable story. I mean, you would think that this woman had been declining rapidly for 4 years and was so severely impaired at that point that, I think that most people would have thought this is a case that is going to be impossible to reverse. Even in severe cases, I'm not saying in every case, we know that it's possible. It's now a possibility, right? Ketogenic diets have unique brain healing properties. The way they energize the brain, the way they reduce inflammation, oxidative stress, the way that they reduce the pressure on metabolism, to, you know, the way that they allow the brain to spend more time in that healing state is just unparalleled. There's no other diet that is capable of this degree of healing. So in a wide variety of conditions. So we now have evidence mounting in bipolar disorder, schizophrenia, major depression. We've got trials going on all around the world, being started up in ADHD, in OCD, in PTSD. And so in anorexia, strangely enough, there is a researcher by the name of Dr. Guido Frank at the University of California, San Diego, who is launching a clinical trial of ketogenic diet in anorexia. Not underweight anorexia, weight restored anorexia, because people who have regained their, have gained weight and recovered, from a weight standpoint from anorexia are still often plagued by eating disordered thinking. And it's been shown in a few very nice cases that have been published that people with weight restored anorexia can see improvement in those in that eating disordered thinking that often persists long after weight has been restored. Now, these studies also use they use a ketogenic diet in combination with ketamine infusions, so it's not the ketogenic diet on its own. But isn't that interesting? I think most people would find it interesting that a ketogenic diet can be used for some very unusual, from some applications you might think would not respond to a ketogenic diet.
So interesting, yeah. I mean, I have very little experience with...
Hey, if you like that video, you need to check out this one here, and I'll see you there.